The Get Into Health programme has helped me to obviously get a job, and it's helped me in my confidence and helped me to understand a proper career and the world of work.
I first started hearing about the programme from on the Job Centre, Prince's Trust, Get Into Hospital programme. It was a work experience. I believe it was about 6-7 weeks, and I knew there was a possible chance at the end of the work experience of getting a full-time job. So I went through, trained with different domestics, learned loads of different skills, and by being confident, full attendance, giving it my all, I got a contract signed, and here I am now, 10 months later.
The partnership works is that Health Education East of England fund for the young people to go through a Prince's Trust programme, and then it supports them after. They can either go into an apprenticeship or onto paid employment, or they can go on and do further training.
At the Oaks Hospital, it's a private one, so it's smaller, and I feel so much more comfortable there. It's not a huge place, and I don't know where I'm going, and I won't know all the people within it. It's small, and you get to know your staff and your colleagues so well, so you're not afraid to ask them any questions. You just get as much as you can from them. You learn just so much with them. They're always willing to help you. It's just a comfortable environment for me and the patients.
The Getting Into a Health related programme helped me, as I didn't know how to get into a job in a hospital, and I wasn't even sure the hospital was where I wanted to work. But Janet, my Prince's Trust lovely leader, helped me by placing me into the Oaks Hospital as a work experience, and that's how I got the apprenticeship.
What motivated me was I'd been a patient, I'd been on the receiving side of it, and I just saw how rewarding it can actually be to see someone progress through sort of after operations and injuries and all sorts, and just the satisfaction that you can get. And I wanted to kind of do it on the other side and be that other person, be that caring for that other person.
I wanted to get into something that would help other people, including, if ever the case, my family or my friends.
We've had great results, and that's not because of me or a nurse or a doctor. It's all of us together giving that all, and the results have said it for themselves. We're doing really well.
A new starter can expect skills, the values of the NHS Constitution, to learn more about those. And they can also learn to see a different side of it from what they might see as a patient, which is what I've found.
The staff nurses don't look at you as just a healthcare assistant. They look at you as another nurse, training as a student, so you really give you an in-depth insight of what is going on and what they're doing. Even though you may not be allowed to do that, but in time they might think, oh, I will be doing that, so it really does help.
The biggest challenge I've had to face is I wasn't the best in a hospital environment to begin with, but the mentors and buddies that we got placed with helped me overcome that, as they're very friendly and helped me to work in a hospital environment.
It's not like nurses see themselves above people. Everyone works together for the patient, to get the patient better, to help the patient recover from things.
My wife has actually started a Prince's Trust course here because I gave her so much positivity, and she was so down out of luck from lack of jobs. And what I'd say to any friends or anybody who wants to do Prince's Trust, really go for it. They're helpful and they will get you through any bad times in your life.